This is one of my favorite topics. It's where we're going to look at how our understanding of sex and of gender and the kind of tension that still exists between those two different categories of identity become complex when we start to consider how they are embodied. So in this topic, as you can see, we are looking at the relationship between gender, sex, and our bodies. And the kind of two major ways that I like to approach this topic is first by looking at the link between reproduction and gender and sex. And so we're going to do that by looking at the work of Martin, as well as MacDonald and Ragone. And then we're going to switch to looking at gender and personhood and how personhood is embodied again through body modifications and rites of passage. So those are the two major topics that this week's topic looks at, or addresses, I should say, rather. And so once again, we have to return back to this nature-nurture dichotomy that's been established in terms of how we understand our bodies. And there's a whole bunch of literature on this, and so we could spend a whole course looking at this, but it's important to note here that we tend to associate females, so biological sex of females, through and understand them through their reproductive role. And interestingly, this reproductive role is also associated with what are called kind of the lower body functions, right? That they're kind of those automatic things that our body does that we don't have control over, right? This means that women then are often framed as being closer to nature, right? That these bodily functions, because they are biological in nature, are naturally occurring, right? However, men then, and the construction of men or maleness then tends to be more of a gender identity. It's less linked with reproductive function, and therefore has been argued that it's linked with these kind of higher mental functions, right? And so already we start to see this difference between males and females as being linked with nature versus nurture, with culture versus or learning or thought, with biology, right? But this dichotomy that we might have, one that is reinforced through our socialization process, which we'll talk about later on the term, one that we learn in our culture, is not necessarily present in all cultures. And so this is why we need to look at cross-cultural analyses to see what, again, the connection between these ideas of sex and gender are with bodies and with personhood. So one of the big questions then we want to answer is, how does gender influence the way we talk about reproduction? So we're actually kind of flipping it. Rather than talking about how reproduction influences gender, we're going to talk about gender influences reproduction. And for that, I wanted you to read this wonderful article by Emily Martin. And I think what's really powerful about this reading is that, again, it shows us that a lot about what we think about being natural or biological is still the product of our cultural learning, right? So the associations we make between the egg with female or feminine characteristics and the sperm with male or masculine characteristics is the product of our cultural learning and our notions of how gender is constructed versus the biological reality. And so this is what Martin refers to as the fairy tale of the egg and the sperm. Now, I didn't post specific reading discussion questions for this. Rather, what I would like you to do is just work through the notes here, work through the reading, and think about some of the information that Martin is presenting here and how potentially your own learning about human reproduction might reflect some of these narratives, right? What did you learn about the roles of, again, the egg and the sperm? Because Martin illustrates that by reviewing several college biology textbooks, and I think it'd be great for a new study to be done almost 20 years later, or almost 30 years later, I guess. 1991 wasn't 20 years ago anymore, is think about, again, the terminology then that we use, the language that we use to describe the sperm versus the egg and their actions, right? And think about how what Martin argues, which is that they're linked with these gender ideas that we have, or as I define on the other term, linked with our gender ideology. So again, this just kind of goes into some of the key points that Martin is then making is that we're taught this fairy tale that uses this gendered language as to the reproductive or biological roles or functions of the sperm and the egg, and then shows that biological research demonstrates a very different dynamic that exists between them. So again, the egg is often constructed as being passive, the sperm is active, but this isn't actually how the biological interaction between these two different types of cells. And remember, that's ultimately what sperm and what an egg is that they are simply that. They are sex cells, right? They are just cells. But we definitely talk about them in these ways that are gendered. So she argues that, and this is kind of the questions that we should always be asking ourselves whenever we encounter challenges to what we've been taught or what we've learned, is why? What is the kind of harm then when children in particular are being taught this fairy tale? Like, is it very harmful? Does it hurt? And she argues, well, really the biggest issue with these fairy tales is that not only does it not reflect what the biological reality, again, of the function and the interaction between these cells is, but it also then promotes gender stereotypes, right? So it kind of boils down gender in many ways and distills gender, and then the genders we have, to kind of the cells that are associated with the biological sex that are also, again, under a heteronormative model, associated with that gender as well, right? So and argues that this then promotes and justifies gender stratification, because essentially what happens is says, okay, well, if eggs behave in this way and biological females produce eggs, right, then gender female individuals are kind of naturally more inclined to behave in the same ways then and represent kind of what the egg does, or vice versa, that eggs therefore represent and behave in ways that are indicative of the gender they're associated with. And we can say the same thing for sperm as well. And that's, again, extremely problematic, because it's then distilling these ideas and the complexity of gender down into these stereotypes. Right. So again, it then enshrines these gender roles in nature and makes them seem natural, right? And the more common and familiar this narrative is, the more natural this narrative becomes, and the more then it's used to reinforce the various types they're based on. So we get this kind of circular form of logic or reasoning that results as or results from these sorts of stereotypes. She also then makes what to me is a really powerful comment as well, is that if we then again continue to think this out and go, okay, what are the consequences then of gender stereotypes, of naturalizing gender roles and whatnot, but also then what happens when we kind of anthropomorphize or make human-like cells, right? What happens when we attribute kind of human-like personalities to eggs and sperm? And she says, because this fairy tale does present the egg and sperm as a couple intentionally trying to conceive a baby, right? The egg selects a mate, prepares him for fusion, protects the resulting offspring from harm. And so there's this intentional action that's part of it. And so this then can become a criterion that's used to establish personhood, and has been actually used in arguments in terms of when life begins. In terms of kind of pro-life versus pro-choice movements, or essentially anti-abortion of movements as they result. So this is kind of something that's really important to look at. And so there's a wonderful website here called scientistcindy.com. And so Scientist Cindy kind of explores this a little bit more. And this is the image that she uses to explain, again, this kind of fairy tale, Vern the sperm meeting Peg the egg. So what she says then is that, again, this isn't really a critique of gender roles itself and gender stereotypes, but again, fundamentally, what she argues the problem is that what kinds of personalities are we bestowing on cells is the very fact that we're doing it at all. And so this is an image from one of my daughter's favorite books. It's called The Human Anatomy Theater, and it's basically a graphic novel that explains in very clear, accessible language to kids the various roles of cells in our bodies, our organ, and everything's presented from an anthropomorphic skeleton. And, it's a really great educational tool. My daughter loves this book. I would highly recommend it for kids. But yeah, one of the interesting things about it is that it personifies cells. It makes cells have personality, so they have like agency, and they're making decisions and choices on behalf of your body as a whole. And this is weird. This is really weird. So while I appreciate that, this is making human anatomy very accessible. And the author of this book did an excellent job with avoiding gendered terminology and gendered language that's not present. Everything's kind of neutral. But again, the still idea that, the cytoplasm here is like the jelly-like substance inside the cell. So it kind of looks like this amorphous doofus kind of looking thing, right? Its eyes are kind of pointing off to the side. The nucleus containing the genetic instructions for the cell, is this smart little cell here. The mitochondria providing energy for the cell. Look, it's going to eat an apple. It's all proud of itself. And they all have these weird little personalities with it. And again, it's cute and makes it accessible. But why? Why do we think that kids need to have cute things in order for them to be accessible? Are there other ways that we can do this? And again, this book does an excellent job of explaining the roles and functions of the various aspects of our bodies. And it doesn't always rely on this kind of personification. Okay. So if we're going to talk about reproduction and we're going to talk about sex cells, then we should talk about menstruation as well. And this is a topic I'm really passionate about because as, again, a cis woman who has a uterus and who menstruates, I know too much information, but just deal with it in this class. But also as one who has a daughter, and, I consider myself not just like a sex positive educator, but also I'm, 100% behind inclusive, diverse, and informative sex education as well for children beginning at the earliest ages. Like, kids need to know about their bodies. I think that's really important, is that we need to talk about menstruation, because how menstruation is also then described and talked or not talked about is also informative. So if we think about then, so we tell kids this fairy tale of the egg and the sperm, so this is how reproduction occurs. Well, then part of that as well is what happens when an egg is not fertilized is menstruation. And this, of course, happens way more often than a fertilization of an egg occurs, right? So then we have the menstruation process. And so think about the language then that was used when you were learning about menstruation, or did you even learn about menstruation? Because when I was taught this back in the day, they separated us on the basis of gender. So all the girls went into one room with a female teacher, and all the boys went into another room with a boy teacher, and the boys were taught something. And then us girls had, a girl talk about menstruation. And so that's when the demonstration of menstrual hygiene products occurred. That's when it was talked about what some of the experiences of being a menstruating individual would be like. And so it was kind of made taboo. It was kind of made as this kind of secret, kind of esoteric knowledge that only, again, members of the female, or it was really what they were getting at was individuals with uteruses, who they were assuming were females, right, would get and would obtain and had access to and had the right to knowing. And this can be problematic too then, because again, think about the gendered language we use. We talk about feminine versus menstrual hygiene products, right? So I'd actively encourage that people use just menstrual hygiene products, because not all individuals who menstruate are female, identify as female. We also have to think about then why there's so much taboo around how we talk about it. There's been some wonderful work that's been done on why do menstruation product ads always use like the blue liquid to demonstrate the efficiency of a pad or of a tampon. Why are the individuals, largely women, right, clearly female identifying individuals, wearing white when that's just not a very practical thing? Why do we not talk about the different kinds of products that can be used and provided? So this is something that's really critical to look at. And one of the articles I thought I would draw your attention to was one talking about the lived experiences of an individual who was a marathoner and chose to run the marathon when they were menstruating, and explained their choice not to use menstrual hygiene products, that instead to free bleed, and how this photo that I'm using here went viral. And this is a photo that the London Marathon runner, the individual in the image, permitted to be used and distributed in this way. So I feel comfortable. I don't feel this is exploitative of her experience. But she talks about her experiences of why she chose to do it. And part of it was she wanted to address how menstruation often is framed as something taboo and not to talk about, and how particularly with marathon runners, this can be very challenging because of you can't just stop in the middle of the race to change your product. There's a lot of different kinds of products that can be used, but not all of them are comfortable or appropriate for an activity like running a marathon. So I just wanted to use this kind of to open the floor, hopefully when we talk about this in our Collaborate session, to talk about menstruation and the taboo around it a little bit more. And then we can also talk about some of the cross-cultural perspectives on this, and maybe some of the experiences individuals have had where it is more or less taboo. This is an example of a cross-cultural perspective on menstruation. And so this is the work of Sarah Lamb. I'm not having you read this article. It's not a required reading, but I thought I'd summarize some of the key points. That with the Bengalis, menstruation is associated with purity, and it's not explicitly because it's linked with the female gender, or the female sex rather, but rather that purity itself, as I state here, is associated with touching and also the controlled exchange of bodily fluids in general. And so the fact that women menstruate makes them kind of more impure because it's yet another fluid that needs to be maintained and controlled. And so they are expected to adhere more strongly to cultural practices that are associated with disciplining the body and purifying the body. What's interesting is that we might think that this is kind of controlling or restricting, limiting, but it's also seen as a positive in that menstruation is associated with openness or readiness for reproduction and for marriage. And then this creates a number of other interesting things relating to kind of closing. So when you become open to reproduce, to marry, then that itself necessitates other coverings and seclusion. So it kind of closes yourself because in some ways it's this tension between bodies as being private or public, right? And so this is kind of a very interesting cross-cultural perspective that we might not think about sometimes about what it means to be a menstruating individual and how menstruation itself then shapes your interaction with other members within the group. So for me, the next logical step is we've talked about the roles of reproductive sex cells. We've looked at menstruation. Well, what happens when that sperm is successful and fertilizes an egg and it results in pregnancy? So that's the next topic I want to look at. And of course, pregnancy and childbirth are very gendered. And that's why I assigned the two readings from the text that I did, the MacDonald reading and the Ragone reading as all. And so there's a huge field of study in anthropology on pregnancy and childbirth. And what we see is a whole bunch of cultural variations on health beliefs and practices regarding pregnancy itself. So when it's appropriate to get pregnant, what a healthy pregnancy looks like, what the expectations of a pregnant or expecting parent are in terms of how they care for themselves and for the developing fetus. For delivery, so especially in terms of pain management, lots of cross-cultural studies showing expectations around even how pregnant individuals are prepared for the delivery experience and potentially for the experience of pain in the context of delivery. So in some cultures it's normalized, it's naturalized. In other cultures it's seen as it's just not talked about. So it can be very shocking and come upon pregnant individuals very suddenly. We can also think about more broadly how newborns and mothers themselves are treated. I remember bringing my daughter when she was about a month old to campus, to the University of Alberta, where I was teaching, to introduce her to my coworkers and colleagues. And I ran into a formal student, and he was shocked that I had my daughter there because she was only a month old. And he said in his community where he came from, so he was an international student, he'd come to Edmonton to study, he said that women and newborns did not leave their house until an extended period, I believe it was 3 months, because during that time period, the newborn is seen as very much at risk for not just kind of medical reasons, but also risk for supernatural reasons. And we'll talk about religion later on in the course. And so he said, my daughter wouldn't have even had a proper name at that point. So he was kind of surprised to see her, but he was also very excited that everything went well. And he had some lovely words of support and also blessings to share with us, which was lovely. But it just really enforced to me that even how we think about who should see newborns and interacts with them is culturally regulated. And then, of course, mothers' bodies and pregnant bodies themselves are treated very differently in our society. And cross-culturally as well. What's very interesting is that in my experiences and those of people I know who've been pregnant, that pregnant bodies are perceived of as public spaces. So people comment on you, interestingly, often very critically. So, what are you carrying in there? When are you expecting? When are you due? Rather, when are you expecting? What are you expecting? Right? Like people ask you very private questions and even in some cases will touch you as well. Like a lot of people want to touch pregnant women's baby or bellies, and it's very weird because you just wouldn't walk up to any other stranger on the street and be like, "Oh my goodness, can I touch your belly?" Like, no, why would you do that? My sister-in-law had an interesting experience where she was buying groceries, and this woman came over and started taking items out of her basket. It was like, you can't buy these are not healthy for your baby, right? So this kind of public perception of what also is acceptable in terms of consuming foods, what you can eat, what you can't eat, can you smoke, can you drink, can you have cheeses or shellfish, or all these things are all culturally subscribed and prescribed to mothers, right? And so we have a whole bunch of different kind of variations then that shape the way that pregnancy is not only understood and childbirth is understood, but also how it's experienced by individuals. And so Robbie Davis Floyd talks about how here in the West, birth has become technocratic, that it is associated with the techniques and technologies of Western biomedicine. And so that has consequences then in terms of how pregnancy and childbirth is experienced, right? So you go to all these checkups, you're expected to have like blood work done, you have a sonogram, you have an ultrasound, you have all of these different medical procedures done throughout, and it's all in the name of maintaining your health and that of the fetus. But it then has consequences in terms of the experience, right? It might seem less natural then as a result because you have all of these different forms of interventions. Again, this idea of it being a very stressful time, but that the stress is also a normal part of this experience. And so we'll talk about a little bit later on this topic about how this is associated then with the pregnancy being a liminal phase and a rite of passage. It represents when you're not quite a parent, but also not a parent. And so this is associated with stress and other forms of tension. So that leads us to then our two readings. So I'm not going to talk about them in this video. Instead, we'll talk about them in Blackboard Collaborate. And please do look at the discussion questions that are in the text. So MacDonald looks at, again, this idea of, well, what then is a natural birth, and argues that it is a cultural construct. And so gets into this and also a little bit on the technocratic biomedical side versus how midwifery frames pain management differently, and so she talks a lot about how power and choice are seen as really critical. Ragone, on the other hand, then looks at how we have to also rethink about biological models, kinship and family, and we'll return to kinship and family later on in the term. But how surrogacy is a significant part of this, because not only individuals who have children are biological parents, right? And biological parents can even be defined in several different ways. And so in Ragone's study, what they look at is some of the differences in the different kinds of surrogacy that are present, and also then some of the consequences of this shift in how offspring that are produced by surrogacy, and more importantly, how parents are perceived of in the context of surrogacy as well. Okay. So that's the first part of this topic, which is, again, sex, gender, and the body. And now I want to get more specifically into constructing personhood by looking at some other aspects that relate to how we understand our bodies and how our bodies are used to express our identities. So there's a whole bunch of different ways that personhood itself is also cross-culturally variable, right? That sex and gender are only part of our identities. Our age, as we'll talk about throughout this term, but also at the end of the term, our status and our rank, our physical appearance, naming, all of these different things are used to reflect and represent our identities. And in many societies, I'd argue in almost every single society, there is a transformation of the body that is seen as an essential part of your identity and an essential part of establishing your personhood. And one of the main ways that this is done is through intentional, deliberate body modifications that are associated with rites of passage. So what is a rite of passage? Well, you've experienced one. We all have. Rites of passage are those rituals, ceremonies, events that are used to mark the transition of an individual from one stage of life into another, right? And I think the classic stage or life passage that really resonates with students is that of a graduation ceremony, right? And anthropologists define rites of passage, and this comes originally, I believe, from the work of Victor Turner. include 3 stages. And so what are these 3 stages? So the first of the 3 stages is separation, or the preliminal stage. And so if we think about a graduation ceremony, this is the beginning, this is before the ceremony actually happens, but kind of right before it, where you, the individual who is undergoing the rite of passage, is separated from everyone else. So at your graduation ceremony, this is when you're shuffled off into a side room, and you put on the cap and the gown that mark you as an initiate of that rite of passage, right? So you're setting yourself apart from all of the other members of society who are there to participate in the rite. And this is the important thing about rites of passage, is they are participatory, right? That various stages have various other members of society who are there to support you through this and kind of help you navigate through these different stages. So separation is when your status as the person undergoing that rite of passage is marked in a clear way. And again, clothing is often a clear way of indicating this. And this is a non-permanent body modification, right? Then we enter the liminal phase, or the transition, or the segregation, or the threshold stage. And this is the stage at which the kind of key rites of the rites of passage are occurring. So in a graduation ceremony, this is when the ceremony is in progress, right? So this is when they're talking about what all went on, they're giving out awards, all of the things that are leading up to the actual point at which you become a graduate versus a graduand of that institution, right? And so it's leading up to that key point where you're walking across the stage, right? And then after that liminal phase, or that in-between phase, you go into the integration, reaggregation, or incorporation phase, where you're brought back then into a member of society, now with your new status and rank bestowed upon you, right? So this is when you are now a graduate of the institution, of your high school, eventually of MacEwan, right? You'll become an alumnus of MacEwan University. And then you'll hear, when you do the graduation ceremony, you're actually tasked with and challenged to go forth with all the rights and privileges that you now have as a degree holder at MacEwan University, right? So again, marriages are another common rite of passage, and you can think about how these 3 stages can vary cross-culturally, how they can vary depending on who the participants are and what the rite of passage is, right? Sometimes you're going through like graduation with a group or a cohort of other people who've achieved the same or similar rank, right? Or status. Others are very specific, like marriage between a couple of individuals, right? So we have a whole bunch of different kinds of rites of passage. So I'd like you to think about then how you could understand a rite of passage and provide an example of a rite of passage, but using this terminology. Okay. So associated with these rites of passage are often transformations of the body and a form of modification. And so I already mentioned an example of a temporary body modification associated with a rite of passage, which is the wearing of the person undergoing the graduation ceremony, right? The graduate or the graduand. So we refer to you as a graduand when you're in the ceremony, and then a graduate once the ceremony is complete and you've officially received your degree and the rank that comes with that. And you're wearing your little cap, and then you move your little tassel over depending on, at certain points in the ceremony. But you can think about different forms of paint or makeup or cosmetics. We can change things like hair. In some cultures, you do not cut the hair until the individuals achieved a certain age. Where you cut it, how you cut it, the hair color, of course, lots of objects, not just clothing, but jewelry, right? So you think about in a marriage ceremony, it's very common to exchange something like rings, right? So you think about the placement of the ring, the exchanging of the rings during that liminal phase to mark now, and then you wear that ring as a symbol of your status, right? Diet and bodybuilding are other ways that we can temporarily modify our bodies to reflect different aspects of our identity. Tanning and skin lightening are also really interesting. Some forms, tanning, of course, is a response to the exposure of UV radiation. In our skin, we have an increase of melanin, or a color-causing pigment in our skin cells, but it is temporary. It eventually goes away. Skin lightening is a little bit more question marky in terms of whether or not it's temporary or permanent, but in some cultures, there's a preference for lighter or fairer colored skin. So for example, when I go to like beauty little shops or salons or little stalls in the marketplace, or if I'm in a bigger city and like Dar es Salaam, and I'm in like a supermarket, like a Western style supermarket, In the cosmetics area, there's almost always skin lightening products or skin evening products. So this idea of that we should and can change our bodies to reflect some sort of values around beauty or status or whatever. This is all cultures do this, but of course, how these things play out varies cross culturally. And of course, then we have a whole bunch of different kinds of permanent forms of modification. Scarification occurs in many cultures, piercings, bindings, surgical alterations. And no, I'm using surgical alterations and not cosmetic surgery because I myself have had a surgical alteration. I had my appendix taken out. That was not a cosmetic decision. It was because my appendix was trying to kill me. So doctors removed it, but it resulted in a scar that's about this long on my abdomen. This was before the little fancy scopes they can now use to go in and just remove that out, but they had to cut me open. My uncle, on the other hand, he also had appendicitis as a child, and because he's significantly older than me, and surgical methods, of course, change over time, his scar runs from his belly button all the way to basically his spinal cord. Like, they really opened his gut up, right? So I just wanted to reinforce that because sometimes when I say things like surgical alterations, people immediately think like breast or bum augmentations, nose jobs and whatnot. But even some of those aren't cosmetic as well. They relate again to the health and wellness of individuals. And so something we can talk about is how surgical alterations like mastectomies, for example, really do transform the body in a meaningful and significant way to those individuals who've experienced that, and can actually cause some tension and crises in an individual in understanding and being comfortable with their gender, because a key part of their body that they associate with their gender has been lost or modified or changed. Circumcision is another really important one. We'll look at that. Tattoos, and I want you to look at a video done by Lars Krutak, the kind of tattoo anthropologist, and he talks about that, and I posted some study questions about the significance of tattooing as a body modification, and he gives some excellent examples of that as well. So I want to go back to this idea of circumcision, and I want to now introduce a different term for that, which is genital modification, because it is a controversial cultural practice, not just within our own culture, but across culturally as well. We see it in many other cultures where various forms of genital modification are performed. And again, the reason why I wanted to talk about genital modification is that it is almost always explicitly linked with a rite of passage, right? So it's a way that a member of a society goes from usually either their personhood, so a member of that community is affirmed, such as a male individual being circumcised as part of the Jewish faith, right? It marks them as a member of that faith. But in other cases, it signals the transition from childhood into adulthood. So the reason why we call it genital modification is that it varies significantly in terms of what form this modification takes, right? In some cases, because of the awareness of female genital modification, and the kind of intensity of the form that this can take, it has been labeled as female genital mutilation to symbolize its disapproval, particularly by those of us in the Western cultures. And so this is where I want you to kind of think about this from a cultural relativistic perspective, is regardless of what your personal opinions are on genital modification or circumcision or genital mutilation, is as an anthropologist, I'm not seeking to approve this cultural practice, but rather understand why is it undertaken. So I definitely have my own opinions on this. I'm not going to share them with you. That's not my job as an educator and as an anthropologist and as someone who's trying to teach you how to use the anthropological perspective. Instead, what my job is to say, okay, how can we study this as an anthropologist? How can we attempt to understand this, right? So part of the reason, and usually the safest and the easiest place for us to start, is, well, why do people disapprove of these practices? And it's often because here in the West, the medical risks that are associated with them, that there are really high incidences of physical problems associated with female genital modification, both in terms of often how it's done. It's often not done in what here in the West we would prefer when our body is being modified in that way, in kind of a very, what we could deem a hygienic or sterile environment with appropriate tools, done by a medical practitioner, right? Instead, what we tend to see this as is something that's being done in an unsafe or unclean environment by an individual who may be seen as a practitioner but isn't a doctor with formal training. Although that's also a lie, because they do have formal training to do this, but it's right. It's not within a university setting or within that kind of, again, technocratic biomedical understanding of that concept, but also as after effects as well. And so UNESCO's done a lot of studies on this that have shown that there's really high risks of infection, of inflammation. There's some really, again, very life-altering impacts that this can occur for women who undergo genital modification, or often young girls who undergo genital modification. There can be little fissures and holes that can be created between the vagina itself and the rectum, which can become then, of course, increasingly inflamed because you have fluids from different systems interacting with each other. There can be complications with either having penetrative sex or with obtaining or with becoming pregnant as a result of that. There's a lot of pain that can be associated because it is performed on young individuals, as again, that rite of passage of young girls transitioning into womanhood. Again, it's seen as being a very intrusive modification on very young individuals who aren't able to really consent to the practice. So we'll talk about children and consent next topic, and how that can be again another twisty issue for us. So again, so we can understand disapproval often quite readily because of our own positioning. But why then would individuals undertake this procedure, right? When we take this biomedical perspective or this Western perspective, we're only seeing certain kinds of facts being presented. The reason why cultures practice it is because it's valued for what it symbolizes and what it marks, right? So some of the things that cross-culturally we've seen genital modification marking are things like family honor, chastity, again, adulthood, basically being an adult member of that community, and therefore being accorded all the rights associated with that, including things like marriage, having a job, owning property, owning a house, etc., all these different things. Purity, status, cleanliness, smoothness, again, membership in a particular ethnic group or religious group. So all of these different things are arguments presented for why it is important and why it's valued. For some, it is perceived as something you can choose to do or not. So some rites of passage require it. Others say, well, if the individual chooses to do this, they can, but just because they don't doesn't necessarily mean that they don't get all of the full rights to this. In other cases, they feel they have no choice, that it is tradition and custom. And also, again, that not undergoing the modification will prevent them from accessing certain things. So particularly, a lot of women have reported that they underwent the genital modification because they knew if they did not, they would be seen as and viewed as unmarriable, that they would never be married, because basically men expect their wives to be circumcised, or have genital modifications. So even anthropologists, as I state here, are divided on this issues. It does represent an ethical dilemma in anthropology as well. And there's a lot of tension then around this idea of individual and cultural rights versus human rights around this. Okay, so again, your job in this class is attempt to understand the why. You can form your own opinions, absolutely, but I won't ask you for your opinions. I don't, in this course, I want you to work on being an anthropologist and looking at the arguments for why this practice is viewed as problematic, and also why individuals continue to persist to do it. And another important note is that in many cases, women are very well aware of some of the risks that are associated with it. And again, I'm emphasizing women because the physical risks are much higher associated with women than they are with men and male genital modification, but there are risks associated with that as well. So I don't want to downplay that, but basically when individuals of any sex or of any body type undergo a genital modification, there is always a risk associated with it. So individuals often know what these risks are, and again, willingly are expose themselves to this risk because, again, of what it then symbolizes, what it then opens up, and the opportunities they then have access to afterwards. So that's why I wanted you to read the Gulbis reading, is that it talks about cosmetic surgery. In this case specifically, she addresses cosmetic surgery in Venezuela and looks at some of the cultural values that have shaped and made cosmetic surgery so prevalent and so important to particularly not just women, but also men in Venezuela as a means for affirming their gender identities. So do look at this reading, and we can talk about this a little bit more about how there is we cannot downplay as anthropologists, again, this idea of the psychological significance of looking good and feeling good, of having a body that affirms our identity, and then the risks that we're willing to undertake in some cases to ensure that our body is the body that makes sense to our identity, that it affirms and displays, and because this is another important part of it, displays the identity we wish to express to other individuals. So clearly what we're seeing here is still the continuation of this tension between what is natural and what is a product of our cultural learning. We see, hopefully what you're taking away from this is that this tension influences how we understand and describe and define our bodies, even down to the very cellular level, that we personify and gender cells, and that this then has consequences all the way up through to when we start to conceptualize ourselves as individuals. And so in order to establish then our identities and personhoods, we can and do transform or modify our bodies. And when we do this, sometimes it's not only to conform to gender ideologies and gender stereotypes, but in some cases it's also to challenge gender stereotypes and gender ideologies as well. So a lot to think about this week. I'm excited. I think we'll have a lot of productive discussion. So do the readings. I know it's hard coming off the midterm, but start to engage with some of the readings, and I will see you at our Collaborate session.